Hello there, and welcome back. You're tuned to the Weekend Show, and our guest tonight, we have with us Dr. Abdulmohsen Al Terki, and Dr. Abdulmohsen is a consultant in ENT and head and neck surgery, as well as the Canadian Board and Fellowship. And Dr. Abdulmohsen, it's nice to have you with us right here on the Weekend Show this evening.
Likewise, nice meeting you.
And Dr. Abdulmohsen, we'll start out with the questions that we have for you. Can you tell our audience about the new ENT clinic that was recently established at Dasman Diabetes Institute? Tell us the purpose of this clinic. A little background, please.
Sure. This was a job that took a year with the agreement with Dasman Diabetes Institute, with Sabah Al-Ahmed Centre for Creativity and Giftedness.
Yeah.
And what happened is that due to a patency that we developed some sort of a way to diagnose patients better with whom have obstructive sleep apnea, and or what people know as a snoring. We found out that there was a lot of research came out saying that if you have this problem, then diabetes will be another issue. And there was a recommendation came out from an institute called the International Diabetes Foundation. They recommended that if you have type 2 diabetes, you have obstructive sleep apnea, and vice versa. So after that, we sat down and delegated, and with the help of the Ministry of Health, we decided that Dasman would be a nice, ideal place to start this way of doing that ENT. ENT clinic, we have lots of ENT clinics, well equipped all over the country. Alhamdulillah, there's no issues of that, we have shortages. But to have a clinic in a place where we see primarily diabetic patients, that was an achievement. Why Dasman? Because two issues. One, Dasman is well equipped, the infrastructure is excellent, there's a lot of subspecialty doctors, you see a lot of, the eye doctors, kidneys, diabetic specialist doctors. And the other thing is there's a lot of foundation for research. So instead of we talking, also walk the walk, meaning that at the end of a year or two we'll have data supporting that we can make patients with diabetes have a better life, better control of their problem if we get rid of this problem, which is the obstructive sleep apnea. Now, obstructive sleep apnea...
Yeah, what is it, doctor?
Good question.
About that.
Basically, there's two issues. Well, first, snoring. Snoring is a social sound that comes out, 40% of the population, they snore. But the issue is that it's a partial obstruction of the upper airway. Okay, so you had a big supper, too much coffee that day, you were tired, you could snore. But when you go to the level of obstructive sleep apnea, the issue is that you are having a complete obstruction of your airway, meaning is like you feel like someone's choking you. Now, the definition of it, the scientific definition, is that complete blockage or cessation of the upper airway that could happen for 10 seconds or more, and say, if you say an average 8 or 7 hours you sleep at night, it could happen hundreds of times. Now, patient will say, but doc, I don't choke, I don't wake up. Well, it's that you have to go in some way we call deep sleep. Sleep goes into different phases. Now, the quality sleep really is that when you go in the depth sleep where you start, the cells start regenerating the memory. The brain actually works when you sleep. So it erases all the bad memories, regenerates the growth hormone, all these things happen. Now, if you don't do that and you go continuously, you'll end up with other diseases, God forbid. Diabetes is one of the issues. But we found out there's something called insulin-resistant diabetes, meaning the patient is taking his medicine, exercising, watching his diet, and still he comes to you, doc, my diabetes, my sugar is still high. So we found out that the apnea or the obstruction causes this issue. Plus, the risk of heart attacks, the risk of stroke, the risk of lack of concentration, getting into depression, sexual dysfunction, infertility, that all these things are related to obstructive sleep apnea. Now, why are we talking about it now? Because we found out that with the research recently, there was a nice paper coming from Stanford stating that no matter how much you exercise, or let's say if you smoke or you got high cholesterol, your sleep tells you how long you live. The quality of sleep tells you how long you live a good life with good, in good health and good shape. Because no matter what you do, let's say you are a a sports freak. You go to the gym every day and you do this, but the quality of sleep, not now, I'm not saying about hours. Now that's very important. If you sleep like 10 hours a day, but you get obstructed and you don't have a problem, the quality won't be that good. So basically you maybe got 2 hours out of it. That will cause you get into trouble. That will cause you getting, God forbid, going into the other phase of diabetes, hypertension, all these other risky diseases. Now, why is it important? Because there's a nice quote got it from a book actually, said that cancer affects some people, sleep affects everybody. So at some stage in your life, you probably had this, what we call insomnia or jet lag, but all these things are fixable. And the problem of obstructive sleep apnea, one of the issues that we have in Dasman is that 80% of the people who have it don't know they have it, because you have to go through a mechanism of questionnaires and testing and examination.
It's difficult to diagnose.
The problem is denial.
And how do you diagnose it?
Good question. That's where the patency came in that we talked about. It happened that it took me I've been working on it for the past 3-4 years, and basically we presented that in the States and other places in the world actually, and the issue is that how to kind of make life easier for the patients to diagnose them. So there's a lot of things. There's a questionnaire that we ask to screen the patients. Not everyone will come to the clinic and say I have apnea. So you screen them, and then there's a specific score, and then when they have the score, you send them to my clinic, for example.
This is all patients?
Patients. Well, the issue is, good question. The issue is that this man was starting with diabetic patients, but honestly now the medicine is changing. How many doctors you visited, and who did any doctor ever ask you, how do you sleep? What's your sleep quality? Are you sleeping enough?
No, they ask about, are you eating well?
Exactly.
Very rarely. Yeah.
Exactly. So the issue now is like the medicine is changing. It's revolutionizing in the sense that 1/3 of your life you sleep. So might as well ask how you sleep, and I had a lot of patients actually when they come to take, I said, how's your sleep? Why you're asking me this? It doesn't. And then when you go and collaborate in these questions, you find out that actually they have insomnia. Okay, you send them to the specialized doctor, and that's it. Or they have what we're talking about today, obstructive sleep apnea. It's fixable. You can do it. What you do is that there's specific x-rays, which is available in Dasman, scopes, things you can do, and then you can tell them that you do have a problem. It could be fixed by using a specific machine or surgical or whatever, but at least now you have a diagnosis. The other issue is, let's say if you are having this problem, let's say you're diabetic and you come to us, even if you don't have it, it's a nice way to warn people, listen, if you keep going to this pattern, promise you, not this year, not next year, you'll get it. And then you'll get into trouble, and you start gaining weight, and you start having this issue breathing, and then you get on the things that what we call irreversible damage. Now, so far, when you catch them up early, you can reverse it, you can fix it, you can make it better. But if you leave it, and there was another nice study actually that was done in the States, it takes sometimes up to 7 years to diagnose a patient with obstructive sleep apnea.
And by then?
By then it's too late. You got the diabetes, you got the blood pressure, you got the, all these issues. Basically. So the thing is about Dasman, what we did, and of course Dr. Kazem, and then we got Dr. Amar al-Bannai, who was the director at Sabah Al-Ahmed Centre for Creativity and Giftedness. What happened is that we said, okay, let's put them in a place, let's start, do it this way, diagnose these guys, patients, and by the way, not only adults, kids too.
Sure, yeah,
kids, because they're catching up, the amount of diabetes is fairly high in Kuwait. Exactly, and then the quality of sleep, and then there's so many studies talking about kids would have speech delay, lack of concentration, poor academic achievement, all these things. The kid, even there was some syndrome called attention deficit disorder. Yes, when you ask, he's jumping around things, and then when you ask about sleep, no, he snores, he doesn't sleep, he sweats. Let's say you do a tonsil adenoid, and voila, he's done. He's like completely different child. So the thing is, what we are doing now is diagnosis. Of course, because once you put your finger on where the problem is, you can fix it. Plus, let's say you don't have it, which is a great news. At least the awareness will increase. Say, listen, this is the issue, this is the problem. Be careful. If you don't play, you should be doing it. You'll get in trouble. Because there's a lot of issues about one of the issues that we always get a lot that you are, you have to lose weight. You have to lose 20 kg. Well, I'll tell you what, if you're obstructed and you got this apnea issue, you'll never be able to lose weight because you barely can walk, you cannot exercise, you're always tired, you're always not feeling the energy.
Are there any symptoms, doctor, that you may want to inform the audience that they may have sleep apnea? That
Well, first of all, as I said, it's the partner, the wife, the husband, the mom will tell you that they snore, they stop breathing, they get into the choking attacks. Plus, they always say that lack of concentration. You get into phases that after lunch you just go for a snooze. Some of them actually go so bad they sleep on the steering wheel. When it gets a red traffic light, they just go for a few seconds. They lack concentration. Even sometimes they go so bad as that, let's say, Kuwaiti culture, diwaniya, or they're sitting somewhere and they're talking.
Like narcolepsy, sort of.
It's really, and it's really alarming because it kind of,
dangerous as well.
It is, and it's something that's reversible because I got a lot of patients actually say, but doc, I've been doing this for 20 years and, you're telling me now it's abnormal. Yeah, well, medicine got advanced and now we can pick it up easier. So it's a matter of, telling the patients that there are ways to fix it, there's ways to kind of diagnose it. And once you tell them, if they have it, great, you can fix it. If they don't have it, it's a nice, or let's say preventive medicine in a way that you can alarm them. And amazingly is that, you see one patient, being such a small society, you see the cousins, the nephews, and everybody comes in and they talk about it. And then suddenly you got a family that are fully aware and they tell other families. And that's the way it goes on. So I think what we're talking about, Dasman, earlier, is that it's a nice place to start because of the foundation, the infrastructure, plus the capability of doing research. And then if it works, fantastic.
So you're starting off with primarily diabetic patients,
basically.
But you intend to even tackle
I've been
children,
doing, absolutely.
pregnant women.
Yeah.
What are some of the causes of how do you get sleep apnea?
A lot of issues. There is one of the things that we did about the patency is that some what we call anatomical abnormalities. Let's say mechanical, meaning they got the septum, the nasal deviation, they got the big tonsils, the
Sinuses,
neck, the sinuses. One of the patency part. What I did, there was a 15 point in the upper airway, meaning if you start from the nose going down to the neck, there's 15 points of potential obstruction that you have to score. In the past, what we do is that you open the mouth and you see big tonsils, take them out. Well, is that the only problem? I don't know. We'll find out in 6 months. It doesn't work that way because patients, our lifestyle, the way we do things, I cannot wait 6 months and then do another surgery.
Sure.
The risk of anesthesia. I mean, it's not easy to go in under, a mask and then come back again, do it again. So what we do now is that we score the patient, meaning, we bring all these capabilities for X-rays, scopes, sleep study. What we do, one of the other things, important arms of diagnosis, is there's a machine that you do asleep where they measure the oxygen, the breathing pattern, the way the muscle moves. The advanced one, actually, they measure the brain waves, the heart, and they can tell you how many episodes of apnea or obstruction that you have, and then you can categorize the patient: snoring, mild, moderate, severe, what we call OSA or obstructive sleep apnea.
So
and then you can tackle. It is actually, that's the thing. And what I did was a simple way of thinking. I brought all this in one, package. Okay, yes, it's expensive, but it saves lives.
It works, yeah.
And instead of me going and doing the tonsil and they say, okay, well, you know what, let's do an X-ray now, and then, let's do the nose. What we do is that we bring everything in one setting, tell the patient, if you have it, then we can offer. Not only surgical, sometimes we tell them,
the treatment, I mean, according
for
to
sinus, we missed a lot of, you mentioned about, pregnant ladies and things, and they have sinuses, and it's so subtle that you only pick it up in X-ray. And then you tell them about how's your breathing, how's your sense of smell. No, doc, and then you give them medication and done. For example, the nose, sometimes you put a scope and then you look all the way at the back and there's a huge, let's say, an adenoid that you see, and then say, well, doc, I tried all this, well, it's a surgical issue, we can fix it. So what you're doing now really, as you said, is like diagnosis. You pick it up, you tell the patients, and you let them aware of what's going on and what's going to be the next phase. Once you do that, and the way to do it actually, to clarify that everything's okay, We repeat the sleep study, let's say in 3 months or 6 months, and then we compare. And the patient psychologically,
So a follow-up, yeah.
basically, that's the way it goes.
So the treatment varies on every patient.
It's a customized
Yes.
treatment. Let's say
So
if you
there's
have
not
twin
one
brothers.
sort of-
No, no, no. I wish. Not so easy. But that's the thing. When you have a customized treatment, let's say not only your age, your weight, the level of obstruction. Let's say a person was snoring. The sleep study was normal. You wouldn't tell him, "Come, take your tonsils out, do the tongue, let's do this." You don't do that. And then another comes with a severe obstruction. You wouldn't tell him, "Go lose weight." I'm sorry, you cannot wait. You have to do that. And there's a lot of actually European countries, and we're hopefully collaborating with Dasman, is that it's part of the system that if they do a lot of bariatric surgery, they do a lot of maxillofacial, for the jaw, all these things. Now they have some sort of a team approach. So now the cake gets bigger. You got a big team that comes in. Again, you diagnose them, you set them up, and then you direct. Okay, fine. You take medication. You go to the maxillofacial. You can go to the respirologist, or you fit to go to the ENT. So the patient's happy, the doctor is happy, and it's a win-win situation.
Doctor, tell us a little bit more about the patent that you received from the U.S. Patency office.
Okay.
You touched on it earlier, but tell us a little bit more about that in detail.
Sure. In Kuwait, we've been dealing with the U.S. Patency office for a while. There's a lot of guys actually even brighter than me. They had 3 and 4 patencies. But what happens is that this mechanism, actually, I was talking about it, I gave lectures about it, and then I approached Sabah Al-Ahmed Centre for Creativity and Giftedness, and we spoke to the patency lawyer, showed him, went to the States, presented a couple of lectures. They liked it.
It's a 3-year process.
It's a long process, and actually there was the U.S. government actually signed a treaty that they want to speed up the process because it takes ages to get the recognition. But once you do that, then you have the protection for a specific period of time, and then you can apply it and go from there, and then you can register some place called WIPO, which is the World Intellectual Property Organization. It's based in Geneva, and also they give you protection in 140 countries. But the issue is, it's not about just giving tap in the back of the patient, say, okay, you're fine, go lose weight. It's something that a little bit complicated, but the great thing about it, as we said again, medicine is all about diagnosis, because once you diagnose and you know exactly what you're dealing with, then you can give the proper meds, and that's what wasn't happening accurately in the past.
And this new clinic that's opened up just a couple of days ago, it's also got the latest technology, state-of-the-art equipment that deals with all of these things that you're talking about.
Absolutely, and it's a phase 1, meaning that there's a lot of other issues. You cannot just, 1,000 miles starts with a step. So we, instead of waiting, and that was the thing, we're talking about it, that instead of waiting to get the whole thing, step by step, phase by phase, make it simple. And then step 2, you're going to get a sleep lab, you get other specialties going on.
A more chance of success this way, to start small and get bigger as
because
well.
the problem is also, it's to educate the educators, meaning that now it's not just come in patients and get in and let's do the testing. Now we have to sit our colleagues, explain to them, how to approach it, the score system, the nurses, you have to teach them, to handle the scope. It's a long process.
And you intend to do this through seminars, workshops,
we've done it. We've done it. We brought some professors. We brought some. There was a professor from Holland. I remember there was a visitor professor from Holland. The guy only had 160 publications. That's all. He wrote like 10, 15 books. So he's like, to me, he's the godfather of sleep apnea. Yeah, well, some of them actually they like their job, and actually we're talking that the incentive is very high and dedicated. So the issue is that,
as you are, Dr. Abdulmohsen,
we try to please. We try. But the issue is really the setup was good, and as he said, we started simple and then go step by step. And the support, the technical support, the financial support, all there. And then if it works, then you can say, let's start in a polyclinic, all over the country, and then,
have branches,
or you can, our colleagues, the general practitioners, you can give them a questionnaire and say, if you find there's someone with a question mark or they're having issues, maybe you should give them the questionnaire and go or let your nurse give them the questionnaire, ask about apnea. And it's amazing. The population of sleep apnea is almost 4%. And this is as bad as patients with asthma.
Oh.
But asthma, you can pick it up, you know, wheezing,
you can,
go,
yes,
take the mask,
diagnose
you're done.
very
you know.
easily, treat it.
But the apnea, as I said, 80% of those guys don't know that they have a problem, and then it kind of start building up, and they get in trouble, and then they go into what we said, the irreversible damage that, you know, damage is done. If you're hypertensive, you're going to be in medications all your life. If you, God forbid, get a stroke or a mini stroke, your lifestyle completely changed. Now you have to go and adapt yourself to a different way of life.
So it's more life-changing than asthma.
It is absolutely.
By a lot.
Absolutely.
Doctor, we wish you all the best of luck in your new clinic.
And congratulations as well on your
Thank
vacancy.
Winding up our interview this evening, any last words for our audience watching the weekend show this evening?
Sleep well.
All right then, well, thanks so much for joining us, Dr. Abdulmohsen. We were speaking to Dr. Abdulmohsen Al Terki, consultant in ENT, head and neck surgery, Canadian board and fellowship, and we'd like to wish him all the best of luck in his new clinic and the patients he sees, as well as the research that's going to take place.